Cancer provides a vivid picture of the health inequities that exist between Māori and non-Māori, with Māori having poorer survival for 23 of the 24 most common cancers diagnosed in Aotearoa, New Zealand. Epidemiologist Dr. Jason Gurney has received funding from the Health Research Council aimed at eradicating inequities in cancer survival for Māori. University of Otago Associate Professor Jason Gurney no Ngāpuhi is with us now. Tēnā koe, Professor Gurney. Thank you for joining us.
Kia ora, Neil, how are you?
I'm very well, thank you. Why is this research so important for Māori and for Aotearoa?
Well, for a start, we should acknowledge the pretty amazing contribution that the Health Research Council has made here. They've been supporting Māori health-focused research for a number of years. I keep saying to people, the HRC were supporting equity-focused research way before it was cool.
Okay.
So we need to kind of bear that in mind. We're very grateful for this funding. So the objective of this research is really to bring together, it's a 5-year research program, so it's a really nice chunk of time to work on this area. And the idea is to bring together a bunch of information around what's happening right now in the context of access to cancer services for Māori. So where are Māori getting treated? What is happening in terms of access to surgery and radiation therapy and those sorts of things? And then understanding things like how far are Māori having to travel to get to that treatment, because we've shown quite recently that Māori are having to travel further when you centralise services. And so there's a big push at the moment to centralise services. And so how do we make sure we're putting enough support around Māori to access that care? There's all of these kind of parts of the pathway where inequities can manifest for Māori, and we're trying to essentially throw off the covers as much as possible and identify where those exist.
So how are you planning to build the evidence needed to drive improvement in availability and accessibility of cancer services for Māori?
Well, the first thing is to, as mentioned, to kind of understand what's happening right now, and then looking into the future, what are we going to need right out to the bicentenary, right out to 2040, 2044 in terms of the future cancer burden for Māori? Because if we're not doing extremely well now in terms of survival for Māori from cancer, odds are that's not going to get better on its own, and the burden is only likely to get worse as time goes on. So the idea is to bring together a lot of information around access to surgery, radiation therapy, systemic therapy now, and then project out what we're going to need in the future so that we can start planning for that need going forward.
What kind of research has been available until now? What has this looked like?
Well, up until now, a lot of the research has been, and I include our own research in this, has been a little bit ad hoc. So an example of that is the work that's been done in terms of travel to access services. We've done a couple of papers in the last couple of years. One's looked at stomach and liver cancer, one's looked at lung cancer. The idea with this program of research is we're going to do it for all cancers. So if you like, create a little bit of a Bible of sorts when it comes to this is what access to cancer services looks like for Māori right now. The travel side of things, for example, this is where we are right now in terms of how far Māori have to travel for treatment, disproportionate access to treatment, those sorts of things. So up until now, and again, including myself and our research group, that work has been a little bit ad hoc, cancer by cancer, whereas the idea with this program is to bring that all together in a pan-cancer kind of way.
So what are some of the more critical areas that you believe require a more immediate focus? What would be the biggest priorities for you at this point?
Well, I think it's almost a case of you could pick. there's a shopping list of things that I would potentially pick. But if we were to just focus for a second on the travel related one, we know that if we centralise services, because Māori are more likely to live rurally than Pākehā, if we centralise services, it is more difficult for Māori to access those services. We've shown that in the context of stomach, certainly liver cancer, and now more recently lung cancer. So the kicker to that is that Māori are also much more likely to live in deprivation, so more likely to live further away and less likely to be actually able to afford to access that treatment. That's a really acute problem that we need to solve now, if not last week, because there is a move towards centralising services, because for many cancers, or certainly many cancer treatment types, when you centralise services, in other words, put it in the major hubs, you improve outcomes because you essentially have a bigger pool of clinicians and people who can deal with that type of treatment. But the problem is that's much harder for Māori to get to that treatment. And so there's an acute need to make sure that we're wrapping support around whānau Māori to get to that treatment, because that is a very clear part of the pathway that will be preventing Māori from accessing treatment. And then following on from that, what are the ramifications of a Māori whānau having to borrow money just to get to Auckland, to, those sorts of things that aren't thought about in the context of cancer care enough. They're kind of siloed off, and we need to think about it much more comprehensively and broadly.
And access was never more so evident than, of course, through the pandemic. Dr. Jason Gurney, Associate Professor from the University of Otago, appreciate your time today and for the work you're doing to ensure Māori simply are given a fair go. Ngā mihi.
Ngā mihi, kia ora.